Hi everyone, welcome back to my channel. So in this podcast, I'm going to explain about dissimilar diseases according to 6th edition of Organon by Hahnemann. So in 35th aphorism, it is explained that only based on homeopathic principles only, we can extinguish the diseases that is seen in that is explained by giving two examples. That is the process in nature wherein two dissimilar diseases meet together in one person. Even nature cannot lift a dissimilar disease that is already present through a stronger unhomeopathic disease, that means dissimilar diseases. And also, the result of ordinary medical treatment of diseases with unfitting allopathic medicines, which are incapable of producing an artificial disease, state similar to the disease to be cured. The unhomeopathic employment of ever so strong medicines is just as incapable of curing any disease. To put it in simple words, only similarity of the disease can be an important thing in deciding which whether the disease will be cured or not. Frankly speaking, it is not some practical thing. It's all these aphorisms, up to 70 to 80 aphorisms, are generally theoretical in nature, and I think only some of the points actually make sense and are practically applicable. So I'll be mentioning my experiences along with this explanation of aphorisms as well, because it is highly important what is the practical application of these aphorisms to be known. So in the 36th aphorism, it is given that if two dissimilar diseases meet together in the human being, they are of equal strength, or the older one happens to be stronger, then the older disease will keep the new one away from the body. So there are some examples given, like when severe chronic diseases fend off moderate epidemic ones. Scurvy fends off the plague, eczema fends off the plague, rachitis fends off the smallpox vaccination, and TB fends off moderate epidemic fever. So these are some examples given, which were observed during the time of Hahnemann, or even before that, because even before that only you can take those examples, right? So it is taken from Larry Memoirs et Observations. So it is taken from some description of reminiscence and observations in description of Egypt, volume 1. So back then, these were the instances observed that a stronger chronic disease generally fends off the weaker acute one. Well, I would like to add some points. This may not be applicable to the current pandemic situation going on, but instead, the people who are suffering with chronic diseases tend to get affected more with the acute disease. So I guess it is not a practical point according to me, because I find exact opposite notion of what is being explained in 36th aphorism. So you need to have a knowledge of what it's explained, and I truly believe it's only for exam purpose. Some points are seriously from Organon only for the exam purpose, because they don't make any proper sense or applicability or practical application. So this is one of those scenario, as it is said that severe chronic disease fends off moderate epidemic ones. But in current COVID situation, we get to see that people having comorbs like diabetes, hypertension are suffering a lot, in fact. So that doesn't mean two dissimilar diseases or similar diseases, but it depends on individual to individual. We can't as such come to a conclusion so much easily. So that's what I wanted to say. So coming to the 37th aphorism, moderate allopathic treatments do not alter or cure stronger chronic diseases, even if the treatment goes on for years. So this is something I'll accept with, because we tend to see that in the case of diabetes, hypertension, or say obesity and dyslipidemia, or whatever, these are the chronic situations and chronic rheumatic conditions, and wherein there is complete the human or the person involved or suffering with the disease is not in a situation to get themselves better, because the allopathic medicines are some chemical compositions which temporarily gets off the symptoms and gives some kind of temporary relief, but are not curative, and that is the reason they need to use that medicine for their whole life. So it is something giving a kind of mechanical aid or a chemical aid to the body from external environment, wherein the body is not able to heal or repair itself as such, even in hypothyroidism. So there are many chronic conditions which are completely dependent on medicine for their whole life, which is not true in all instances. So coming to 38th aphorism, it is given that if the new dissimilar disease is stronger, it will suspend the older disease but never cure it. ringworm suspended epilepsy, scurvy suspended the itch diathesis, typhus suspended the TB. So in this 38th aphorism, it is explained that if the newer disease is stronger, then it will suspend the older disease, and the older disease return back to its condition after the new one has run its course. So it can't completely remove the older disease, because older disease have a particular withhold on the economy, because it is being occupied, or it has altered the vitality much more, which with much more stronger strength. So this is something which I accept too, because if you see people suffering with chronic issues also, they may suffer with fever or such, but again once that fever or something goes off, they'll be back to their original situation. Like, it doesn't completely cure or take away. So one disease cannot remove another disease, which is seem to be explanation given in our Organon, but I somehow don't find it somewhat meaningful. There are some examples given in this 38th aphorism regarding that. Coming to 39th aphorism, aggressive allopathic medical treatments merely suppress and suspend a chronic disease for as long as the treatment is kept up, after which the disease always comes back to light again as bad as before or worse. So a diabetic patient's if doesn't make necessary dietary and health style modifications, and just think that taking a diabetic anti-diabetic pill or something which will completely make his sugar levels look normal, once he doesn't take that tablet on time, again his sugar levels shoot up to normalcy. And similar with the hypertensive patients, if the antihypertensive is not taken on time, their BP readings will be very high. So it is something like they completely won't remove the disease, but they merely suppress and suspend a chronic disease, which I totally accept with. So this is a meaningful explanation or observation done. So coming to 40th aphorism, sometimes two diseases of equal strength form a complicated disease in which each of the two occupies a different body part, as in venereal disease complicated with sora, and smallpox complicated with measles, and cowpox complicated with measles, cowpox complicated with syphilis. So these are common diseases found back then, which are very uncommon nowadays, but this is also a plausible or say good observation and explanation. We can see some people are having, we tend to see many patients, they won't come just down with affection of only one single body part or something like particular like that. They'll be explaining so many different symptoms pertaining to so many different organs which don't make any sense at all. They'll be saying sometimes that they suffer with gastric issues, and sometimes we will be explaining expecting they may be having any stool or constipation issues, which doesn't happen. And they'll be sometimes complaining of something called as knee joint pains, and these are not at all related. Like, your gastric issues and your joint issues are something seeming to be not related at all, but they generally are occupying and doing their part. So these can be taken as an example for explanation given in 40th aphorism. Coming to 41st aphorism, complicated diseases occur in nature, however they result much more frequently from protracted allopathic treatment. The natural disease and the artificial medicinal disease pair up and render the patient doubly diseased. So this is something again I'll accept with, because it has been observed recently in one of the scenario of dyslipidemia wherein statins are given. So statins are something which are said to be in hypercholesterolemia condition, there is a situation wherein cholesterol gets deposited onto the blood vessels. So what statins does is they prevent that absorption, so it's a deposition of that fat by altering the elasticity of the blood vessels and altering the blood composition as such. But it has been also found that statin is something having much more complicated effect on the body, not altering the cholesterol levels. It may be rendering some more side effects, including diabetes has been found out one of the added effect of the, or say side effect of the statins, and just that being one of the thing which has been proven in scientific evidences. But if we dig deeper, it has been also found to cause some kind of heart complications, some kind of complications related to hypertension. So this is one of the scenario that can be explained according to 41st aphorism. So I totally accept with this finding. And it is also given in this aphorism that cases of already complicated natural diseases which are further complicated by allopathic treatment are incurable or extremely difficult to cure. that is absolutely true. And unfortunately, we are the sufferers because we tend to get the diseases, maximum of the diseases or maximum of the patients we get are of this state only, and they in turn blame that allopathy gave them relief but homeopathy can't provide them relief. But the truth is, in fact, the allopathy has made them worse, and that's the reason they come to homeopathy, and they expect the thing to happen magic overnight, which is not gonna happen. In fact, their body is being drugged in such a bad way that they are not at all in a good situation to enjoy normal health. In fact, they're diseased more by allopathic medicines. So this is some finding which I totally accept with. And coming to the 42nd aphorism, in some cases it has been stated that nature itself allows 2 or 3 natural diseases to meet in one and the same body. However, this complication only occurs with diseases that are dissimilar to one another, diseases which, according to eternal natural laws, cannot lift, annihilate, or cure one another. Indeed, it appears that 2 or 3 diseases share the organism, as it were, each taking for itself the peculiarly appropriate paths and systems. So, it is explained that dissimilar diseases are very really hard to treat with, and unfortunately we are someone dealing with most of our patients being of falling into that criteria. But I want you guys to understand that whatever you read in Organon, I mean, in your college time and in my college time, I wasn't in a phase to actually question that what is the genuinity or what is the applicability and what is the truth behind that. Because don't forget that homeopathy is an observational and scientific study as well. So observation is something made 200 years back, so that may be changed right now. So once, if you don't find a commonsensical plausible explanation to what you read in Organon, I would advise you to find one. If you don't get, then that means don't believe that, because if you don't find any backup point of what you read, it's highly possible that it may not be true, and believing on to something which is not true, it's again getting yourself into more trouble. So don't do that. Start questioning, start posing good questions. Don't blindly believe what everyone says. Try to understand it in your own way. Read it for a number of times so that you can interpret it in a better way. So that's what I want you guys to inculcate, because that is what we are lacking basically in colleges. It's something only feeding thing is going on, whereas homeopathy is something experimental and observational and most scientific a branch of medicine. So it is something which needs to be experienced and learned rather than to be fed up on by. So that's what I wanted to share in this podcast. So now, from now on, I won't be doing individual podcast. I'll be doing the grouped one, so that it will be easy for you to understand the topic that has been dealt into the aphorisms. And of course, I'll be mentioning aphorism numbers before explaining each and every scenario or say stuff, so that it'll be clear for you what aphorism will be covering what point according to Hahnemann. So hope this podcast was helpful. If so, don't forget to subscribe to this channel. Till then, bye bye and have a great day. Bye.